So the takeaway is, if there was a trauma and our patient is not getting better with conservative care and the pain level is unrelenting and they're not able to rotate, and that's because the body's protecting itself, you want to refer for additional imaging, even if the initial radiographs were negative. So that's not an uncommon scenario. Patients will often have radiographs. I shouldn't say often, but we see a lot of cases like this where patients have negative radiographs in the emergency department, but there truly is an injury that was not discovered. And there's multiple reasons for that. One of the most common errors in radiography in emergency departments is simply not visualizing all 7 vertebrae, that the radiograph was technically made incorrectly and they missed C7. So we've seen cases in the literature of C7 spinous process fractures, for instance, just not on the image. So they couldn't be spoken to because they couldn't be evaluated on that image. There's always the risk that there was a ligamentous injury, but spasm is holding the cervical spine in place, and the ligamentous injury is not evident. And how it would be evident on radiograph is simply because of positioning. If you see that fanning between the 2 vertebrae, between the 2 spinous processes, it's typically from interspinous ligament tearing. But if there's enough spasm and the patient's holding themselves in a protective posture, their cervical lordosis may look normal and may look fine. Another reason is just human error. There's always going to be human error in any part of medicine, and we've all had our experiences with that. And sometimes there's error, not just a failure to read correctly. And remember, in the middle of the night, it's not always radiologists who are reading the radiographs. It might be who's ever available, and there'll be a second read by the radiologist on the day shift. So there might be a lag before you get a pair of expert eyes on that radiograph. That's important to note. And the other thing is, the most important thing, and my favorite textbook starts with this, the most important thing on any image is that you have the patient's correct name stamped on the corner, because